We're really digging into something quite remarkable.
We are. We're looking at the healthcare system in Kerala, India.
Yeah, we've got this pile of source material you sent over, articles, reports, all trying to get at why Kerala's system is so often talked about, like a model almost.
That's the goal, yeah, to sift through it all, understand the pieces, and figure out what makes it tick, what makes it stand out, what the sources tell us.
And right off the bat, I mean, the thing that grabs you are these health stats from Kerala. They're really high.
They really are, surprisingly so.
Like not what you typically expect, maybe.
Yeah.
More like a developed nation in some ways. So the big question is how? How did they manage that?
Okay, yeah, let's unpack that. According to material, the foundation seems to be this very deliberate structure built for access.
A structure.
Yeah.
Okay, tell us about that. How does it actually work on the ground?
Well, it's set up in 3 tiers, 3 levels. At the base, the most local level, you've got primary health centers, PHCs, and even smaller subcenters. These are really the first place people go.
Especially in rural areas, I guess.
Exactly. Rural, semi-urban, your first contact point.
Like a local clinic. What do they actually do there?
It's the basics. Outpatient stuff, really critical maternal and child health services, immunizations, vaccinations, and health education too. Getting essential care close to home.
Makes sense. And if you need something more involved,
then you move up, tier 2. That's where community health centers, the CHCs, and Taluk hospitals come in.
Okay, CHCs and Taluk hospitals, what's different there?
Specialist services. So general medicine, maybe basic surgery, pediatrics, OBGYN. They're also the referral point if a PHC thinks you need, a more advanced look.
So a clear pathway. Start local, get referred up if needed. What's the top tier then?
That's the tertiary level. Think district hospitals, medical colleges, big specialty hospitals.
Right, the major hospitals.
Yeah, for the complex stuff, advanced surgery, specialized treatments. And the sources mention the state runs several medical colleges, which are a big part of this top tier.
That layering, it really sounds like accessibility was the goal from the start. Build it so people can actually get to some level of care.
It does seem that way. But what the sources really stress is that the structure is one thing, but the success comes from how it operates, the features within that structure.
Oh, okay. The secret sauce ingredients, maybe? What are the key ones?
Well, a really big one, highlighted again and again, is this strong focus on public health.
Public health, meaning prevention.
Exactly. It's not just waiting for people to get sick and then treating them. It's heavily weighted towards preventing illness and promoting general wellness across the whole population.
Can you give us examples? What does that look like practically, based on the readings?
It means concrete stuff, regular, widespread vaccination drives, really comprehensive programs for mothers and children, big pushes on sanitation, awareness campaigns.
So very proactive.
Very. And the sources also point to Kerala's early adoption of family planning, birth control measures, as part of this whole preventive mindset historically. The idea being it's smarter and often cheaper to stop problems before they start, right? Especially with limited resources.
Right, tackling things upstream. Makes a lot of sense. What else is distinctive?
Community participation pops up a lot.
Community participation, how so?
Well, the local government bodies, they call them Panchayati Raj institutions, they're actually involved in managing the health centers.
So local control.
Some degree of it, yeah. And then you have these grassroots health workers, accredited social health activists, ASHAs. They're crucial for outreach, connecting directly with people in the villages and towns.
How does involving the community like that actually help the system?
It seems to build local ownership, Makes the health programs maybe more tailored to what people actually need. And these ASHA workers, the sources say they're vital for things like making sure pregnant women get checkups, kids get their shots, health info gets out there, boots on the ground.
And you mentioned earlier Kerala's high literacy. That plays a role too.
A big one, according to the analysis. Kerala has one of the highest literacy rates in India,
Right.
And the material draws a direct line from that to people being, better informed about health. They understand hygiene, nutrition, disease prevention better. They're more likely to seek care when they need it.
So education empowers health choices. That's a powerful link.
It seems to be like a positive cycle. Invest in education, you get better health engagement. And the proof, as you said, is kind of in the pudding, right? The health indicators.
Let's talk about those numbers again. They are pretty striking.
They really are. The sources highlight things like one of India's lowest infant mortality rates. Life expectancy is significantly higher than the national average. Maternal mortality is way down.
Wow.
And birth rates, fertility rates, they're well below the average too. It just shows the real impact of this whole approach.
Those are impressive outcomes. Now, is this all public sector? Is it all government rent?
Not entirely. The sources describe it more as a mix, a public-private mix.
Okay.
There's definitely a robust public system aiming for accessibility, mostly free for basic care. But alongside that, there's a pretty big private healthcare sector, especially in cities.
Interesting. So how do those two interact? What's the dynamic?
Well, the public facilities get a lot of use, particularly by, lower income folks. But the sources indicate that plenty of middle and higher income people use the private sector too.
Why is that?
The reasons often mentioned are things like maybe shorter waiting times or the perception of higher quality facilities or more amenities in some private places. So you end up with the system where the public part provides that essential safety net and the primary care base, but there's also this thriving private market alongside it.
That balance is interesting. Were there specific initiatives mentioned, things they did to strengthen the system over the years?
Yeah, definitely. One recent one that comes up is the ARDRA mission.
ARDRA mission. What's that about?
The main goal seems to be upgrading those primary health centers we talked about, turning them into family health centers. Better buildings, longer hours, more services available right there at the first level.
So reinforcing that foundation makes sense. What about paying for care? Any help there?
Yeah, insurance schemes are mentioned. Kerala uses national ones like Ayushman Bharat, plus they have their own state scheme, the Karunya scheme.
And who are those for?
They're aimed at helping poor and middle-class families cover the costs, especially for hospital stays or more specialized treatment, both in public and some private hospitals too.
And big picture tests. Like, how did the system handle something huge like the COVID-19 pandemic?
That actually gets mentioned quite a bit. Kerala's initial response is often praised in these reports.
In what way?
They point to the strong contact tracing, lots of testing early on, and pretty transparent communication with the public. It suggests that the underlying strengths of the public health network, the community links, maybe the public trust built over time, really helped them manage that crisis, especially at the start.
It really does paint a picture of a system with, deep roots and real strengths. But no system's perfect, right? The sources must mention challenges too.
Oh, absolutely. It's not presented as some kind of utopia. There are definitely hurdles they're facing now.
Such as?
A big one is the rise of non-communicable diseases, NCDs.
You mean like diabetes, heart disease?
Exactly. Diabetes, hypertension, cardiovascular problems. The burden from those is growing significantly.
So the health challenges are shifting from infections maybe to chronic lifestyle diseases.
That seems to be a major theme. And related to that, Kerala has an older population, relatively speaking, compared to the rest of India.
So aging is a factor.
Yeah, and that naturally means more demand for geriatric care, managing long-term health issues that come with age.
Okay, NCDs, aging population, any other strains mentioned?
Overcrowding in the bigger tertiary hospitals comes up.
Why is that happening?
It seems to be partly just the referral system working, but maybe also suggests that the primary and secondary levels can't always handle everything, so people end up pushing towards the top-level hospitals. A bit of a bottleneck.
Right, so maybe success in some areas creates pressure elsewhere?
Could be part of it.
Yeah.
And the final point often raised is cost. Especially in that private sector we talked about, costs are going up, which raises questions about affordability, even with the insurance schemes.
It's really interesting how success itself creates new problems, isn't it?
Yeah.
Like longer lives mean more chronic illness, better basic care might funnel more complex cases upwards.
It really is. And if you try to synthesize it all, connect the dots based on these sources, the reasons for Kerala's success seem to boil down to a few core things.
Yeah. What are they?
It's presented as a combination. Consistent political will over a long time, real public investment, that community involvement piece, and always that strong foundation in primary care and prevention. Not just one thing, but a mix.
So pulling this all together for you, the listener, why should you care about Kerala's system? Why did we spend time on this?
Well, because it's a fascinating real-world case study, isn't it? It shows what can happen when you really prioritize public health, primary care, even in a place without vast resources.
Right.
It offers lessons, insights into how policy, education, community action, how they can all come together to produce health outcomes that kind of defy the odds. It's food for thought for anyone thinking about building better, fairer health systems anywhere.
It definitely makes you think about the power of investing in health right from the community level up.
Absolutely. And I think the really critical question now, the one the sources leave you with, is how does this system, which got so good at handling the basics and infections, how does it adapt? How does it sustain that success when the big challenges now are these chronic diseases and the needs of an older population? That feels like the next chapter for the Kerala model.
A really thought-provoking look at a unique healthcare story. Thanks for walking us through that. For everyone listening, keep pondering those lessons from Kerala. How might they connect to health challenges closer to home? We'll catch you on the next deep dive.